Haley, and today I'm going to be talking about the healthcare heroes. After listening to my speech, listeners will be able to know and understand the responsibilities and characteristics of a healthcare worker and understand how the pandemic has impacted their role. When the rest of the world paused due to COVID-19, the healthcare workers could not. Their duties and responsibilities became 10 times harder to fulfill, and taking care of patients became even more important. Pre-COVID life was simpler as we know today due to a lot of the rules and regulations changing each day because of the virus. According to the article written by the ncbi.gov website, the responsibilities of a nurse, doctor, surgeon, any healthcare worker has drastically changed due to the regulation changes, meaning masks are required at all times, and the nurses say in the hospital they do have to ensure that each patient, each visitor, if visitors are allowed, are being worn. Another thing is nurses or doctors or any other healthcare worker does have to have a big heart. Compassion is a big factor in the healthcare world. There are many devastating events that go on, such as death or telling a family that their loved one has a terminating disease. Those are just a few examples. So nurses, doctors, physicians, counselors, CNAs, anything that does with having to work in the medical field, they do have to be prepared for anything that may come their way. No one ever knows what may happen at any time, and you have to be dedicated, just because if not, things can slip through the cracks, and that could definitely cause you a life. And everyone knows that healthcare workers are there to save lives. Life before COVID-19 was much simpler. If, say, you were in the hospital, you could have visitors in and out during visiting hours. You could roam freely if needed to get out of the hospital bed. Masks were not required unless you were sick with an illness that was contagious. I do know that before COVID, there was a shortage of healthcare workers such as nurses or CNAs, and that required the current employees to work longer hours, meaning that they were away from their family longer. And we do see this now with COVID, especially just because some people can't handle being in the healthcare field just due to all the impact that COVID-19 has brought to us. Another thing is liability. So liability is a huge thing. There is insurances for doctors and surgeons through each hospital, each practice, each doctor's office. But one thing is each employee of the healthcare field does have to know there is a fine line between personal and like business. Just because if there's a HIPAA guideline that is broken, that could be definitely a huge issue for the patient and the physician. In the healthcare life today, according to Robert and What It's Like to Be a Healthcare Worker, there's a lot of fear and anxiety, and that has caused, like I said, many of people to change their profession or just not be able to work at the moment due to the impact of this pandemic. The innovation of telehealth has broadened due to this pandemic once again. So many doctors and physicians, nurse practitioners are able to do a face-to-face video chat. They can do that from their home if they're working from home, or they can do it in an office, and you can do it right from your living room. You could do it while you're at work. However, it's needed to fit your schedule best. I know a lot of people are scared to get out, scared to go to the doctors, not wanting to go to the hospitals. So there are ways you can do an at-home visit, given there are some situations you have to go in, if it's due to an emergency, example like a heart attack, stroke, they can't handle those situations over the screen. According to the Nursing of Georgetown, telehealth is going to be changing the future of medicine as it already is, as we are seeing today. It's just one way that makes it easier on all our elders that are at risk for COVID-19 or any other viruses and sicknesses. In conclusion, working in the medical field, it is rewarding and hard work is definitely needed. There definitely needs to be dedicated humans, dedicated people who are in that medical field, because it's all about saving each patient's life. COVID-19 has caused a lot of extra precautions, as we've all seen, we've all heard, as the vaccine has came out recently. That's one thing that we're hoping that slows down the spread of the virus. That way we can go back to somewhat a normal life. Another thing about working in the healthcare field, in the medical field, it's one big family. You have to be one big family or patients will not be taken care of. It's a big accomplishment. Many people go to school for many years to accomplish their dreams of being the doctor, the surgeon, the nurse practitioner, the nurse, and it is accomplishing or rewarding when a family member comes up to you and says, "Thank you for all you've done for my family member." It is one of the toughest careers just because it can be heartbreaking and it is hard work. Just knowing that you go to work just to take care of patients that possibly may not make it through the day or not, and then you have to go home as if, you have to move on with your life as if nothing happened. Thank you for watching. I hope you now understand what the healthcare field is like pre-COVID, post-COVID, and how dedicated these workers are to taking care of you and me. Thank you.